Good afternoon, everybody. I'm Craig.
And I'm Brittany.
And we are here with IPT Virtual to talk to you today about back pain. Back pain does not care if you are tall, short, fat, thin, male, female. Back pain is going to get you one way or another. So what we want to talk about today is how do you handle your acute back pain? Acute back pain is that time you bend over, you pick the pencil off the floor, and oh, my back goes out. Or in case of a gentleman that I saw yesterday, he had a really long, tough workout. He was really fatigued, and he tried to do a deadlift of a lot of weight, and he overcompensated, and boom, his back went out. So what happens when that goes on, when your back goes out, so to speak?
So it can be a couple of different things. If we're talking more on the discogenic side of things, then we're talking about that disc bulging or coming out from where the spine is. So, well, he's being covered right now. But basically, you have all
It's
these...
cold in Miami.
It is today. So you have all these discs inside your spine. And when you go and you bend forward or you lift something up, what happens is it pushes out almost like toothpaste coming out of the tube.
Yep.
Okay, and if that moves more than it should or pinches on a nerve, then that's when you're going to have that irritated, sharp, maybe tingly pain that radiates. So if that's the case, then that's going to be, like I said, discogenic in nature.
Right.
Usually, if you're a little bit older, if it's more chronic kind of stuff, then you can have stenotic kind of back pain, which is going to be more so compression in the spine, decreased joint space in between the vertebrae and stuff like that.
Right. So what we want to be able to do today is have the conversation around muscle spasm, right? And let's assume that we've cleared all the red flags. If we've got loss of function of the leg, if we have a drop foot, if we have loss of bodily function, if we have all those things that have been cleared by whether it be diagnostic testing or a visit from the physician or even clinical testing within an environment like ours, let's clear that out and let's assume that we're dealing with more muscle spasm based irritation around the spine.
Yeah.
All right. So what are we going to do first? First, we're going to make a determination on what directional preference is. What that means is, does moving in a forward flex position make your pain better or worse or the same? Or does extension work make your pain better, worse, or the same? So what we're going to do with Brittany here, we're going to go through just a very easy, gentle way. So this is assuming that we've rooted out all the red flags and we've gotten rid of anything that we need to do for any medical intervention, and we're now looking at physical stuff here. So I'm going to ask Brittany just to bend forward nice and slow, reaching downward, and what she's looking for is, does her pain increase, decrease, or stay the same? When she comes back up, now Brittany's perfectly fine today. She doesn't have any back issues, but imagine if she did. When she comes back up, she's going to get some tenderness in this area. So maybe what we can do is bend the knees a little bit, use the hands on the thighs, and walk our way back up. So from here, coming back up, better, worse, or the same. If we went into extension, I'd ask Brittany to place her hands on the back of her hips, opening her hips forward, pushing forward, and leaning back. Now, how far back she leans, again, Brittany's got nothing going on with her back today, so she's able to get a large range of motion. If you have a spasm out back, you're probably not going to go very far. And you're going to know after 3 or 4 or 5 repetitions which direction that you are preferring, which is decreasing your discomfort. Is it flexion or it's extension? That's going to determine for you, specifically you, which exercises to do to help you decrease the spasm of your back pain.
And you can also be getting better based on the centralization of any symptoms. So if you have anything that's referring from the back down into the butt, down into the leg, whatever it is, as you go through a couple repetitions of that preferred range of motion, you'll find that, let's say your foot had some tingling in it, that the tingling out of the foot is coming out of the foot and maybe working its way up back into the spine. So it's centralizing back to its main location. So it's not always just the back pain that we're talking. Sometimes it's that irritated nerve running down the leg as well.
And what we talked about earlier with Brittany was talking about the discogenic versus more the musculoskeletal type issues here. If a disc is impinging upon a nerve root in the central canal, your symptoms are going to be very significant. That doesn't mean that if you have compression of a nerve outside of the canal, they're not, but it's different. A muscle might go into spasm and the nerve root travels through the muscle. Masm goes into, I'm sorry, not a nerve root, but a nerve branch goes through the muscle. Muscle might go into spasm and compress that and give you those lateral symptoms or distal symptoms that come down the leg. And the idea of what we call centralization is that symptoms coming further up, closer to the central part of the spine. And that's how we determine a successful treatment: centralization, decreased pain, and decreased spasm of the spine. So what's next? We're going to show you a few exercises. So hang out. We're going to show you some flexion exercises. We're also going to show you some extension exercises. So do your test at home to determine is flexion the right way to go for you, or maybe it's extension. Welcome back, everybody. After we've done our directional preference and we've decided that extension, and this time is the direction that's going to provide us the most amount of comfort, we're going to go through just a few exercises here today to show you a couple of exercises you can do to decrease your acute low back pain. So we've got Brittany here as our model. She's lying down on the table. And if you can just see, and I'm going to move out of the way here, Brittany's already in some amount of extension. This just might be enough extension for somebody to be comfortable, to alleviate or centralize some of that discomfort. So again, just to review, we talked about centralization. If Brittany's having some discomfort down the outside of her leg or down to the back of her knee, centralization would be the centralization or the coming up of that symptomology, the numbness, the tingling with pain, towards the center of her back. That's centralization. So let's start doing some extension work here. So Brittany, go ahead and come up onto your elbows for me. And you can see what Brittany's done here. She's keeping her hips and her belly down, and she's arching up as best as she can, creating a nice swan neck type of an extension here. Her neck is in neutral, her elbows are underneath her shoulders, and she's in a nice, good extension position here. So two ways to do this is repetition. Repetition would be to go up and then come right back down. Your downward position should be as long as your upward position, if not a little bit longer, and then come back down. And we would do this on repetition. Let's do 7 to 10 repetitions, just coming up into this upward position of extension and then coming down. Now the reason, keep going for me, Brittany, as I keep talking here. The reason we want the downward position to be as long as the upward position is the fluidity or movement of the disc material. If you can imagine a jelly donut, the inside part of the donut, the jelly, moves when we go into flexion and extension. And we want to be able to move that inside jelly smoothly and easily through this process. And that takes a little bit of time. So be slow and be very gentle with this. The other way, instead of repetition, is to come up and hold it. Hold the upward position for about 30 seconds to a minute. That also means that your downward position is going to be about 45 seconds to a minute and a half. So this is a static hold in this position, and you can hold for the period of time.
Shoulders are down away from the ears. I'm not here.
That's a very, very good point. So now if Brittany is doing well and she's moving through her spasm, and that's dissipating and getting better and better, and we want to go into more extension, instead of coming up on the elbows, we can come up onto our hands.
And still making sure that those hips stay down, so I'm not up here.
Yeah.
My hips are down. I'm pushing my hips down while I'm also pushing my shoulders down away from my ears.
And come on back down. Good. And let's just do a few here and show what that looks like coming up a little bit further. And again, remember, two different ways to do it. We can do this repetition. Come up and come down. And remember that we are holding the downward position as long as we are holding the up position, a little bit longer actually. And again, please keep in mind, Brittany has a very, very healthy back and has no symptomology here. So we want to make sure that you do what is comfortable for you. Okay, so this is a couple different ways to do extension, and I'm going to have Brittany now come off the table. Into standing, and we're going to do standing extension. So let's say that you're at the office, you're working, and you don't have an opportunity to lie down on a floor, you don't have a table or something to lie on. You can do this type of an extension at the office. Placing your hands in the small of the back down towards the tush, and your hips come forward, and we arch back. Now we do want to arch back as much as we feel comfortable to do so. No pain, no gain doesn't really work here, and there's a difference between acute compressive pain versus discomfort from back ache, back spasms. And remember, we've done all the red flag testing to make sure that we have not, we're not working with anything that is a red flag, that is so discal that we've lost function, that we've got a central canal stenotic scenario with disc material hanging out in there, that we don't have any tumors or any of those kinds of craziness. We've cleared all that stuff out. And the idea here is 10 repetitions every hour. So what'll happen is oftentimes our disc material will slide out slightly, but we have enough room to help guide it back into place. The way to do that is the repetition. So 10 extension repetitions every hour throughout the whole day.
Make sure that movement is coming from here and not the common thing where we see where the knees come forward and my body stays straight. So in this position, it looks like I'm bending backwards, but really my back is not changing at all. My knees are just bending. So you want to keep the legs straight, pretend like you're trying to push your hips over your toes and bring your chest up towards the ceiling at the same time.
Now, if you have any questions on your directional preference, flexion or extension, it's something that you can't figure out. If you're having an acute amount of discomfort, please call us, reach out to us. We'll either help refer you to a physician for further testing. We'll bring you into our offices to do some clinical testing and treat you or refer you to where it needs to be. But if you need help, please reach out. If you can handle this work at home, we encourage you to do so. And we look forward to seeing you soon here at IPT Virtual. Please go to our website, at actually YouTube channel, and subscribe to our channel so you can get the latest videos on whether it's back pain, shoulder pain, knee pain, whatever it might be.
Thanks, guys.